Kate Falcha, welcome to Irish Granny Helen. I'm recording this for YouTube. I'm also going to put it on Substack. I realized today when I was downloading something for Substack that I was talking to my YouTube followers, and that seemed weird. So just to know everybody's included. So it's Black History Month. And I've been thinking a lot about it. So much has changed. No, let me rephrase that. So much hidden has come to the surface because nobody is ashamed. Nobody holds it back anymore. In the past year, especially. And I've often wondered, why is there so little fanfare or so little attention paid Black History Month, except for within the Black community? Do we really mean that when we talk about it? Did we create Black History Month so we could point and say, oh, look, we do that, aren't we? Lovely and unracist. I'm old enough that when I was a child, the contributions to American history made early on focused on people like Christopher Columbus and Lewis and Clark. And we really learned very, very little about Native Americans and virtually nothing about African Americans except for Harriet Tubman and I think Booker T. Washington. I can't remember anybody else. I think they may have mentioned Frederick Douglass, but the fact that it's such a vague memory for me really reflects the fact that he wasn't strongly emphasized. And I always felt that that was a shame. And being an immigrant myself, I came because I wanted to. I'm not laughing because it's funny. I'm laughing because it's painfully ironic. Yeah, being an immigrant myself, I'm maybe a little more just aware, a little more hyper aware, a little more hypersensitive. Not woke enough, but I'm trying. I am very sensitive to slurs and stereotypes against Irish Americans. So anyway, having said that, every year I try to honor African Americans who have made long-lasting contributions to our country. And you know, it's always the same three people. I have to really dig. And I've learned a lot. And this year I thought, you know, maybe what we need to focus on are the issues that affect Black people in the United States that have not been addressed. Every year, lip service paid, Martin Luther King, you know, we all cry and feel terrible. And then we move on. And the social issues continue. So I thought this year, that's how I would approach Black History Month. I'm going to highlight a person, but because of a topic. So sit back, get comfortable. I'm going to talk to you a little bit about the history of Black midwives and the situation with childbirth and the African American community today. We're going to start with that, and then we're going to single out one very important woman who was a Black midwife and contributed so much to her community. So let's get started. Before I start, these are always sensitive subjects because they edge right up to medicine, and YouTube is very reactive about what you say one way or the other about medical stuff. I am not giving medical advice. I'm going to keep my opinion out of this as much as possible because it's not conventional, and I don't want to get in trouble with YouTube. Maybe someday we can quietly go behind the paywall and really talk about this. But in the meantime, I just want to be very clear. I'm not advocating much. The statistics speak for themselves. But before we start, always talk to a doctor. Get prenatal care as early as you possibly can and stick with it. And this is just a review of information and history. This is not intended to be a place of medical advice. Okay, I think that covers all the bases. So let's start with today and the statistics. In 2023, now, of course, it's getting harder and harder to get statistics. We all know what's going on with the CDC and, WHO is still trying, the World Health Organization, and we're leaning heavily on their statistics. But some of this is a couple of years older, and I would venture to guess they're worse now. In 2023, Black women had a maternal death rate of 50.3 per 100,000 live births. Now, I don't know for sure. I don't understand exactly the statistical process that they keep, but I'm assuming that they're specifically saying live births so that if you and the infant die in the process of birth, it's a different statistical category. This is just, I don't know what the proper term is, just unremarkable birth. 50.3 women out of 100,000 Black women die. This is 3 times and more higher than the white maternal death rate, which is 14.5 out of 100,000. For Black infants, 10.93 out of 100,000 do not survive birth, the process of birth. And that's more than twice as high as for white babies. And often this comes with the fact that they have a very low birth rate or they're preterm, premature, early. You can be on time and still have a low birth rate, and that's got to do with a lot of other things, but this is not a place of medical advice. So why are these numbers so absolutely horrendous? Well, studies have been done, and they have come to the conclusion that WHO is great. The World Health Organization is on it. It's due to structural racism, the disparities in the quality of care. They have higher rates of complications during pregnancy and immediately postpartum that are not addressed because there are systemic inequalities. There's inequality in access to care, to insurance coverage, therefore access to care, to a safe environment to give birth. If you're going home with a newborn and you're in an environment of, for example, and I'm not saying that this is true for everybody, this is just one example of extreme poverty, or perhaps there's mental illness in the family or substance abuse. And this can be in any demographic. Just, I'm not singling people out, but we are talking about African-American mothers right now. There can be toxic stress from systemic inequalities that you just, you're harboring this inside yourself when you know you're not being treated fairly as compared to the blonde woman next to you. And it creates things like high blood pressure and stuff. Toxic stress of racial discrimination. And this can lead to physiological issues like high blood pressure and heart disease. Not medical advice, statistical information. Black mothers are 49% more likely to get late or no prenatal care. And, according to the World Health Organization, prenatal care is just paramount. It's also, systemically unconscious bias within the healthcare. Poor or inadequate quality of care or treatment. I witnessed this myself. Oh, those people complain more, don't pay attention. Many Black women in rural areas face higher risk often 2 times the risk of white women in the same area, not because they're in a rural area and everybody else is in the city next to the health center. No, compared to white women who live in exactly the same neighborhood, they have much higher risk, twice as high of a risk. I wonder why that is. In 2025, the mortality rate for white women went down a little bit. That's very good news. For Black women, it went up. According to the World Health Organization, the most crucial factor in a good birth outcome is midwifery, midwives. And it's because they dug into this to figure out why. It's because of the continuity of care model. And we're going to talk about that a little bit. Now, I'm not advocating, I'm not criticizing anything. I'm simply presenting the statistical results of World Health Organization studies and their conclusions. Apparently, according to the World Health Organization, it makes an enormous decision favorable to a positive outcome to maintain the same caregivers through your pregnancy, your labor, and postpartum. Fancy that. You develop a relationship and they know you. Remarkable. There's it's highly respected midwifery because it's based on individualized care. This reduces intervention. It reduces the necessity to get all up in the process and interfere with it, and it allows it, the process of birth, and it allows it to unfold, monitored carefully, but hands off unless necessary. So how do you optimize the chances of a safe and healthy birth? It's about, according to WHO, it's about relationship-based support, trust, which is, this is not only physiological, this is psychological factors. It's important for women to have consistent emotional, psychological, and physical support, all three. And they've shown statistically that women who are attended during their prenatal care, their birth, and their postpartum care by other women do better. Preventative care and safety goes along with this. It reduces the rates of C-sections, which are surgery. It reduces the rates of instrument deliveries, which have their own issues. And it helps, because of the good prenatal care, it helps to reduce the number of preterm babies. And we all know how hard that is. Also, to optimize your chances, you need clinical competence. And there is a prevailing prejudice against midwifery because people continue to maintain the old and untrue stereotypes. But skilled evidence-based care prevents complications. And midwives come in a variety of types. There are the midwives who go to midwifery school, and they do exist in the United States, and are licensed and certified and monitored and tested, and an eye is kept on them. But some of them are nurse midwives, and some of them are professional midwives, and their type of care is slightly different. Nurse midwives tend, not always, now I am generalizing, but they tend to work within the confines of a hospital or a birthing center, and licensed lay midwives who are just as trained, just as equipped, provide services in other places like at home. Midwives respect a woman's dignity, autonomy, and informed decision making. They're not told, just don't worry your pretty little head. Who recommends this approach? Who has done these studies and has come out with the evidentiary backing that the most safe and successful births happen with midwives. They provide safer or equivalent outcomes for low-risk pregnancies. Now, you need to be somebody who's healthy. You need to be somebody who doesn't have, what's the word I want? Comorbidities, like other problems. If you go into a pregnancy with issues like diabetes or high blood pressure, that kind of thing, you would not be considered necessarily, and once again, this is not medical advice, but this is based on whose evaluation, they would be more concerned about monitoring you and having you under a doctor's care. So midwives step in. If you're healthy and everything seems to be going well, they have the best outcomes. Certainly, midwives' care result in higher patient satisfaction, more success in breastfeeding, and more long-term breastfeeding, which correlates with positive statistics for infant health and development. Fewer unnecessary interventions if you have a midwife, like an episiotomy, for example, or breaking the water, the amniotic sac. If you have a midwife, you have at least a 25% lower chance of having a C-section. You get more personalized hand-on experience if you're the mother. So in 2014, the New York Times did a whole big expose using WHO studies, but also other smaller, like professional journalistic, medical journalistic papers. And they came out with the goods that midwives provide safer care than OBGYN. The risks associated with midwifery are mostly to the provider and not to the patient. The midwife has a higher level of stress because they have long, unpredictable hours. They often don't have anybody to step in for them. They have more than one birth at the same time. It's very stressful. They have high insurance costs. They have a higher risk of being sued. And the salary they get is not that great. And so it's really difficult finding a life-work balance. Trained, licensed midwives have all the equipment that you would expect an OBGYN to have. Intubation equipment, oxygen, Pitocin to stop uterine hemorrhage. Now, once again, not medical advice. This is all in the WHO study. There's different types of midwives, as I said, and in a hospital setting, there are midwives, and they can provide full pain options, pain treatment options. If you're at home with the midwife, they can provide some of those options. They do not do epidurals. They prefer to first opt for patient-centered solutions to pain, natural, non-pharmacological methods. So they don't jump to drugs immediately. They do things like massage, movement, hydrotherapy, but they can administer medications. You're not volunteering for torture. They always explore all of your options. Oh, I said you should always explore all of your options and know your risks. Educate yourself. Very important. Consult a doctor. Talk to midwives. Really find out the truth. Be prepared to seek medical intervention always. The key to all of this is great prenatal care. And that is, as we saw in the early statistics, sadly lacking for especially African American women. So I was thinking a lot about the role of midwives in earlier times, in poorer communities, and in African American communities. And they played a singular role because Black women weren't allowed into hospitals in the early days and in the South. So let's talk about one particular African-American midwife who stood out for her remarkably long career and her incredible successes. Her name was Margaret Charles Smith. She was born September 12th, 1906 in Utah, but it's spelled E-U-T-A-W. I thought that was really funny. I wonder if they were thinking the same thing, but Utah, Alabama. When she was 3 weeks old, her own mother died, and so she was raised by her grandparents who were farmers. Her grandmother had been enslaved and was a midwife for the slave population. Margaret went to rural grammar school, segregated, and often was interrupted in her education to go help on the farm. When her grandfather died when she was 16, she left school permanently. She was known throughout her life by her clients and her neighbors as Miss Margaret. She assisted at her first birth when she was 5. So she was the only one home when this cousin, and this is really interesting. So I guess her cousin and his wife were living with her, or she was at their house at the age of 5 and there was nobody else home. And the wife went into labor and there was nobody to help. And so she caught the baby. Interestingly, it wasn't her cousin. I'm sorry. It wasn't her cousin. It was a cousin of her future husband. So for some reason, she was in this house as a 5-year-old along with this pregnant woman who went into labor. There was no help. She caught the baby, and some decade or so later, she married this woman's cousin. So although she was interested in midwifery in her teens, she never had the opportunity to do anything about the interest, but she began training in her late 30s with a local midwife, Ella Anderson. In 1949, she got a county permit to be a midwife. She was one of the first official licensed by the county midwives. Before that, they were just granny midwives, which is an unofficial term. The grandmothers were the ones who helped. Early on, they weren't officially trained. But later on, they had experience, but they didn't have a piece of paper. But later on, of course, they did. Midwives were crucial to Black women in the South because the hospitals would not admit them. So Margaret worked for 28 years in 3 local clinics with doctors as the area slowly adopted modern medicine. In 35 years of helping with babies, she caught more than 3,000 babies. Often, her population that she served was very poor. Often the mothers were impoverished, malnourished, and in poor health as a result, which, knowing the statistics we talked about a few minutes ago, would set them up for complications and problems. Often, they had too many pregnancies too close together. Not a good situation. Margaret never lost a mother in all those births, and her population of patients, as I said, were particularly vulnerable to complications. She never lost a mother, and over 3,000 babies delivered, she only lost a couple. I mean, like a handful, fewer than 5. She delivered breech twins. That's when they're upside down or sideways instead of head first, the way they should be. She delivered premature babies at home. Many mothers could not pay her. They paid her in produce or eggs, or she might, if she were lucky, get $5 or $10 per birth. During her years working as a midwife between approximately 1945 and 1980, she did a little bit of work before she got the official license. At that time, the African American infant mortality rate was about anywhere between 22 to 74 for 1,000 births. So her success rate was really enormous. It was incredible. In 1976, Alabama outlawed traditional midwifery. And they let Margaret continue working because of her experience, but they just turned kind of a blind eye is what they did. They issued her permits until 1981, and after that, they said no more. Later, Alabama let nurse midwives work in hospitals under the supervision of a doctor. In 1996, with the help of somebody helping her, she wrote a book called Listen to Me Good, The Life Story of an Alabama Midwife. Actually, the woman who helped her was a research scientist who was working for the National Black Women's Health Project. And this, she recognized Margaret's contribution. And it really went beyond the memoir of a midwife, but it really examined class and race in a state that was the epicenter of civil rights struggle. As to her personal life, she met Randall Smith in school, in her one-room schoolhouse. In 1943, they were married. Now, I don't know if this is the husband that she attended his cousin's wife's birth when she was 5. I'm not sure. They were married in 1943, and he became a hog farmer. They had 3 sons. She had her first baby in her teens. She was her own midwife for the second baby. She was the midwife for her firstborn grandchild and was at the birth of this granddaughter's first baby. So she helped with her first great grandchild. Her family farmed until just before her death. She wasn't very healthy, but she lived to be 98, so healthy enough. She died in 2004. There's a documentary about her called, come out in 2008 called Miss Margaret. I have to remember to watch that. Now I decided, okay, let's see what's going on in Alabama today. So keep in mind that the job she filled was outlawed. Today, Alabama has one of the highest maternal mortality rates in the country, 36 to 39 per 100,000 deaths, 36 to 39 deaths per 100,000 births. That was a statistic from 2022. And according to the experts who've studied this, 62.5% of those are entirely preventable. In 2020, they had the 3rd highest maternal mortality rate in the US. For Black women, it was 100 per 100,000. And so they looked into it. What are the causes? Maternity deserts. 25 counties in Alabama have no OBGYN at all. And 21 more are very limited. A lot of rural hospitals closing down. Long travel distances. There are places, I was listening to something about this, and they were saying in our community, the country hospital is shut because of current administrative choices nationally. And because the hospital has shut down, our women in labor now have to travel 45 minutes to get to help. The long travel distance hospital closures, hospital workforce shortages. They don't have enough nurses. They don't have enough people in the hospital to help. Lack of expanded Medicaid. In Alabama, and this was banned until 2017. In Alabama, they have what's called a certified professional midwife, and they're licensed. So only 2% of the births in Alabama use midwives. The demand is high, but there just aren't enough to meet the demand. The cost for a birth with the midwife is about, it depends, like what you need and how long, and etc., between $2,000 and $5,000. The CDC looked into this and said that the deaths during pregnancy leading up to birth, 80% of them are preventable. So I looked up a few statistics here. Alabama is number 4th highest, or it's the bottom, one of the bottom of the barrel states when it comes to births, deaths and problems, mortality and morbidity. So what's the worst place? Tennessee. Number 2, Louisiana. Number 3, Mississippi. Number 4, Alabama. Number 5, Arkansas. Number 6, Kentucky. Do you see a pattern? And then looking at the other end of the scale, who were the best? Number 1, California. Number 2, Minnesota. Number 3, kind of a very close tie between Massachusetts, Vermont, Connecticut, Rhode Island, and New Hampshire. And do you see a pattern? I see geopolitical patterns there. So that's my presentation on Margaret Smith, the midwife, Miss Margaret, African-American midwife, who provided remarkable care to her community for decades. She should be honored, as should all midwives. And there is a burgeoning movement within the African-American community nationwide to return to trained midwives as an alternative to try to help to improve the rates of mortality and morbidity, but also to improve the experience and to provide service for the African-American community. So that's all I know. Once again, no medical advice here, just observations, statistics from the experts, and factual evidence. And I hope that this was interesting. Happy Black History Month, and Slán go fóill, slánte.